Prophylactic cranial irradiation is a somewhat nuanced topic. Previously, the really this was the standard of care, and still is the standard of care, although now in question. It was previously the standard of care because there were studies that showed that when a group of patients, one was randomized to get radiation to the brain, and we say prophylactic, meaning that there's no known cancer in the brain, but you're radiating it to eliminate any microscopic disease. Just like I described with the chemotherapy, this was radiation to the brain to eliminate any potential microscopic disease. And the group that got the prophylactic cranial irradiation ended up having better survival. And so that's really compelling when we see a group of people live longer because of something. That being said, these were older studies, and there was not an MRI brain before before randomizing to the radiation or monitoring. And more recently, there was a study out of Japan that looked at doing MRI brain before that randomization, and then in the control group, meaning the group that did not get radiation, doing an MRI every 3 months. And really, that ended up being, as far as a survival and standpoint, those were similar. So the group that did not get radiation prophylactically did end up having more cancers that showed up in the brain that were later treated, but that did not impact their survival in the longer run, it doesn't seem. Now, we can get into some of the statistics of that, and it's a little more nuanced than I'm presenting it right now, but that has certainly raised the question as to whether or not doing radiation is really so important if there's not anything known to be in the brain, or if just monitoring with scans is considered reasonable. And there's been kind of a general shift in not really doing as much of that prophylactic cranial irradiation, particularly in extensive stage disease. In limited stage disease, where we're really going for cure, I think there's still more of a tendency to give that treatment. The trial that I described out of Japan was an extensive stage disease, so that's not that curative intent setting. So there is an ongoing trial in the U.S. now in both limited stage and extensive stage for a randomization to either getting prophylactic cranial irradiation or getting ongoing every 3-month MRI brain. And for some people, they feel strongly about either getting the radiation or not getting the radiation. And if people feel strongly about that, I think both are justifiable. For those who don't feel strongly and who say, well, we're not quite sure what to make of all of this, and therefore I'm willing to get either, then actually the trial is a great way to go.